In this video, we're going to talk about what to expect after your anterior cervical discectomy. We'll talk about issues like pain, swallowing, feeling tired, what to do if you have to wear a cervical collar, and how you can cut down or quit smoking. So let's get started.
Okay, we're going to talk about what to expect after your anterior cervical discectomy. We call it a fusion and plating too, okay? Because you're going to have a few days. You start with the day of surgery. We're going to make a little timeline here, okay? Boink, there we go. And then you have day 1. Here's your surgery date. Day 2, day 3 after surgery, day 4. You also say post-op. So day 5 post-op, day 6 after surgery, day 7 post-operatively, okay? So let's talk about what happens during these days, okay? So for the first day, you're going to feel really good. There's going to be this big bump, smiley face. Yay, I didn't die. Okay, good. And you didn't. That's really good, all right? However, what happens after from day 2 to about day 5, you're going to have increased in swelling in your neck after the surgery. Day 2 to day 5 after surgery, you get an increase in the swelling of the tissues, and that's going to make you miserable, okay? So just kind of expect that. However, starting after day 5 or so, you're going to be on the upswing, and you're going to be this rocket that's going to the moon, okay? So this is the general gist of things, and what we'd like to talk about now is some things you can do from day 1 all the way and up through day 5 or so, which are going to help you. We're going to actually preempt the problems. We're going to try to prevent problems rather than wait for problems to arise and treat them. So here we go. So let's talk about some short-term issues that people have after anterior cervical discectomy, fusion and plating, okay? Well, number 1, since you had an operation, you're probably going to have some pain. Usually not a lot, but it's enough to bother you. What other issues do people have? Well, because we worked in the back of your neck and we moved your esophagus, that tube that connects your mouth and your stomach aside, you're going to have some difficulty swallowing, which usually gets better. People feel tired because you had a general anesthetic. If you do have a collar, you're going to have to get used to that. And one of the things we'd like you to do if you are still smoking is to quit. So we're going to talk about each one of these issues, and we're going to see what we can do to preempt the problems that you can get with those issues. Okay, so what can we do to help ourselves get ahead of the problem as opposed to just waiting for the problems to arise? Well, let's take our regular day, and we'll start it at 6 a.m., and we go to noon, and we go to about 6 p.m. And by 10 o'clock at night, we're getting kind of tired, so I want to go to bed. So we'll make a little cycle of our day here, going through that. Let's talk about what we can do at every step of the way here to help ourselves. Well, one of the things we're going to get post-operatively, typically, is some narcotic. Nucynta, Lortab, something like that, okay? One thing to do is to take that narcotic 4 times a day for a few days when you get home, and then the following 3 to 5 days. Just take it around the clock. You know you're going to be sore, so you may as well just take it, okay? So do that, unless it makes you feel like a zombie or something. What else can we use? Well, one really good thing that's actually getting to be more and more used nowadays in hospitals, so you may as well use it at home, is some combination of Tylenol, acetaminophen, paracetamol, and a non-steroidal like ibuprofen. In fact, people are using that in hospital, and it's actually cutting down narcotic use a lot. So why don't you just start taking that? Take some of that at 9 a.m., about the 3-hour mark in between your narcotics. take some at about 3 p.m. at the 3-hour mark in the afternoon, take some at roughly 9 p.m. And if you're up later at night, you can take a dose around midnight or so, okay? So now you're getting some medication about every 3 hours when you're awake, and you're alternating between your narcotics and your Tylenol and your ibuprofen, and that's a very good thing. So what else can we use to make ourselves feel better? Well, one of the things we use in the hospital all the time is an ice pack, and we really like that. So I would say every couple hours or so, when you're in the middle of the day, throw an ice pack on your neck for about 10 minutes. Obviously, don't give yourself frostbite, okay? But when you think about it and make a little schedule, when you take your medicine, and maybe 1 or 2 times in between, put a little ice on that neck, because that will decrease the swelling and keep that postoperative swelling from getting into your problems in the first place. And then finally, to keep that tiredness or to get rid of the tiredness, walking is about the best plan you can do. So every hour or so during the day, you do a little walk. Just get up for about 5 minutes and walk around gently. You don't have to go jumping up and down stairs, no running, no rugby playing, please. But just about every hour, you get yourself up and you get yourself moving. That cuts down on the chance of you getting a pneumonia because you're cleaning out your lungs. It cuts down on your chance of getting blood clots in your legs because those legs are moving. And all of this is happening. So this is kind of your schedule for the first 3 to 5 days after surgery. What you're doing is you're taking the medicine you're prescribed, you're taking some Motrin Tylenol in between, you're putting ice on your neck, and you're walking regularly.
Okay, so the usual disclaimer, you watching this video does not make me your doctor. Use common sense. If it hurts when you do that, don't do that. And always keep in contact with your own healthcare provider throughout this. So we are all over the web. We have a very active Facebook page with our patients. We are big time tweeters, and we are way into Instagram. To see more videos about anterior cervical discectomy surgery, general spine info, our blog, or to contact us, just hit us at DoctorRodz.com.